Wash my hands. Knock on the door. Good morning, Mr. Smith.
Morning.
My name is Tabitha Killen, and I am a physical therapy student from the University of Missouri. And your doctor actually gave you a referral for some physical therapy on that right knee you had replaced a couple days ago.
Okay.
Okay? So what I'm going to do today is while you're laying down, I'd like to get some vital signs. Then I'd like to do some range of motion with your legs here to see how those joints are moving. Get some measurements on that knee to see how good it's moving after the surgery. Then I'd like to do some sensation tests and do some joint and motion position sense down here on your ankles. Then after that, I'm going to get you setting up here on the side of the bed, and then we'll do some manual muscle testing to check the strength of your muscles. And then I'll help you get up, and we'll transfer over to this wheelchair so we can go now to physical therapy.
Okay.
Do you understand what we're going to do today?
Sure do.
Can you repeat back to me what we're going to do?
Yeah, we'll look at my range of motion, how my joints are moving, sensation, sensation of my ankle, and then do some strength tests, and then transfer it to the wheelchair and take it down to PT.
Okay, that's good. Now, do you give your permission for us to proceed today?
Yes, ma'am.
Okay, so first, I'd like to get some vital signs. While I'm getting that ready, can you tell me, do you have any stairs at home that you're going to be going back to that we have to worry about?
Just like two steps on the front porch.
Just 2 steps? And do you have a railing there that you can use?
Yeah, I do.
Okay. And when you get home, are you going to have somebody there that'll help you?
Yeah, my wife will be there to help me out.
Okay. Now, has anybody ever told you that you can't have blood pressure taken on this arm, or have you had a surgery on this side?
No, it should be okay.
Okay, that's good. Let me feel that artery here. Okay. Okay, it was about 124/78. That's usually typical of what blood pressures run, so that's good. Okay, now I'm going to get your pulse right here. And while I'm doing that, can you tell me, on a scale of 0 to 10, 10 being the worst pain imaginable, how much pain do you feel in that knee right now?
Oh, I'd say about 5.
Okay. So it's about 67 there for your pulse.
Okay.
Now first I want to do some range of motion with these legs here.
Okay.
Okay, so we're going to do the left leg first. Oh, I see the nurses put a pillow under your knees.
Yeah, just to help me be more comfortable.
Well, we typically do not like a pillow to be under the knees because it causes that knee to be bent after the surgery, and then we can't get all the range of motion and extension back that we like. So typically we'd like you not to have the pillow under the knee so we can just stretch it out a little bit, okay? Okay. So I'm going to check out this hip here. Can you bend your knee for me? Good. Okay, that looks good. Okay, I'm going to take it out to the side here. looks good. Now test this ankle. That looks good. Okay, so now I'm going to have to test a few things on your right leg here. It might hurt a little bit. I'll try not to make it last too long.
Okay.
I'll be sure to support this knee. Okay. See the hip here. That looks good. I'm going to take it out to the side. Good. Now test this ankle. That looks good. Now notice there's a little stiffness in this knee here, so I'd like to take some range of motion on it.
Okay.
Some measurements to see where we're at. Okay, so first I'm going to poke around on some bones here. Okay, now can you bend that knee up for me? Slide that heel up towards your head. Is that as far as it'll go?
Yeah, that's about it.
Okay. Looks like we are at about 36 degrees there. Let's slide it. I'm going to add a little more pressure to get it up a little higher. Is that as far as it'll go?
Yeah.
Okay, it looks like we're at 61. Okay, now I'm going to have you straighten this leg out for me. As far as it'll go. Let me get my goniometer lined up here again. Okay, we are at 25. Now I want to just kind of add a little pressure to see how far we can get down there. Okay. We got down to about 21. That's a good place to start. Okay, so now I'd like to do some sensation tests on your legs. So I've got this cotton swab. Now I'm just going to rub it against your skin. Every time you feel it, I want you to say yes, okay?
Okay.
So I'm going to ask you to close your eyes.
Okay.
And every time you feel me rub this cotton, just say yes.
Okay. Yes. 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 Yes.
Okay, good. Now I'm going to switch to your other side here.
Okay.
Now every time you feel it, keep those eyes closed, but tell me yes every time you feel it.
Okay. Yes. 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 Yes.
Okay, that's good. Now I'm going to change it up a little bit. I'm going to ask you to close your eyes, and I'm going to touch you here and here. I'm going to ask you if they feel the same, okay?
Okay.
Okay, so close those eyes.
Okay.
Now, does this feel the same as this?
Yes.
What about this and this?
Yes.
This and this?
Yes.
This and this?
Yes.
How about this and this?
No, this one felt stronger.
Okay, so your left side felt stronger?
Yeah.
What about this and this?
Same thing, left side.
Left side? Okay. And this and this?
Yes.
Same. Okay, that's good. Thank you. Now, what I want to do is test your ankles here to get a sense of your motion and your position sense with that ankle, okay?
Okay.
So first I'm going to do this leg. Now, I'm going to either put it up, down, in, or out. And after I get it there, after it stops moving, I'd like you to tell me where it's at, okay?
Okay.
So can you close your eyes for me?
Mhm.
Okay.
Up. In. Out. Out. Down. Up. In.
Okay, good. Now I'm going to do the same thing over on this foot, okay?
Okay.
So remember, when it stops moving, tell me which direction it's in.
Okay.
Close those eyes.
Up. In. down, up.
Okay, good. Now we're going to do something a little different this time, okay? I'm going to move this foot, and then as soon as I move this ankle, as soon as you start feeling motion, I want you to see you do the same thing with that ankle, okay?
Okay.
So if I start moving this up, as soon as you feel it, move up, just like that, okay?
Okay.
So close those eyes. Okay, good, good. Okay, now I'm going to get you setting up, so I'm going to get your shoes on here for you.
Okay.
And now the doctor said he does not want you putting any weight on this right knee, okay?
Okay.
So when we get set up at the side of the bed, it's okay to let it hang down and let the heel touch the floor, but I don't want you putting any weight through that leg when we stand up.
Okay.
Well, I gotta get these a little tighter so they don't slip off. That's better. How's that pain doing now?
It's about the same.
About the same?
Yeah.
Okay. Okay, now I'm going to help you get on up to sitting at the side of the bed.
Okay.
I'm going to ask you to get up on your elbows. Okay, now I'm going to have you swing around on your elbows to this side of the bed, and I'm going to help you with move these feet along, okay?
Okay.
Okay, now can we scoot out a little bit? I'm just going to let this leg rest on the floor here. Now how do you feel? Do you feel like you're balanced? Do you feel like you're going to fall over?
I feel good.
Okay, so I'm going to put this robe on you so we make sure we're all covered up when we go out into the hallway.
Okay.
So can you put that arm through there? Good. This other side. Good. Make sure we're all covered up. I'm going to take this sheet out of the way so it doesn't get in our way here. It feels like it's a little stuck there. There we go. Okay, now what I want to do while we're sitting here is I want to get some muscle strength testing done.
Okay.
So I'm going to ask you for this arm, can you hold it out to your side and just keep holding it up for me? Don't let me push it down. Good. Now can you pull it back like this for me? Don't let me push it in. Okay, now out at the side. Good. Good. Now can you hold it down at your side? Okay. I'm going to try to pull it out. Don't let me pull it out. Okay. Now I'm going to try to push this elbow down. Don't let me push it down. Okay, now let's go out the side. And I'm going to try to push this elbow in. Don't let me push it in. Okay, now back down at your side. I'm going to try some rotation stuff here. So don't let me push this in.
Okay.
Don't let me pull it out. Okay, good job. Now I'm going to try this arm here, and I'm going to try to twist your arm so that it goes like this, okay? Don't let me do that.
Okay.
Good. Now can you flip it over for me? Okay, now I'm going to try to go the other way. Good job. Okay. Now can you flex that wrist up for me? And turn it over. There we go. Don't let me push down. Now I want you to squeeze my fingers as hard as you can. Good, good. Now typically I would do the other side, but since we're running out of time, we're going to just kind of let that go for today, okay?
Okay.
Okay, so I want to test out this leg here, so can you flex that hip up off the table a little bit? There you go. Don't let me push it down. Good. Now I'm going to try to pull this knee out. Don't let me pull it out. Okay, can you extend that knee for me now? Okay. Don't let me push it down. Good. Now relax your leg. Okay. Now can you push out against my hand? Push in against my hand. Good. Now let's check out that ankle. Can you flex it up here? There we go. Good. Now just relax. Can you flex up that big toe for me? Good. Okay. Now we're going to try some things on this leg. I don't know if we can get that hip up there, but let's just try. Can you get it up there for me? Is it too painful for you?
Kinda hurts, yeah.
Okay, so we won't work on that today, but just, can you push in toward me, my hand here? Good. Push out. Good. Now we won't worry about the knee right now.
Okay.
Can you flex that foot up for me? Okay. Okay, good. Now what about that big toe? Extend that up. Good, okay. Now I want to get some more measurements on this knee in this position because sometimes when you sit up, we can get a little more range of motion. So I just want to measure that here.
Okay.
Okay. Let me find my landmarks again. Okay, now can you bend that leg up? Push that heel in here. That's good. Okay, let's see what we've got here. We are at about 45 degrees here. I'm going to add just a little bit of pressure so we can get a little further. And check my landmarks here. Okay, we are at 56 degrees. Good. Now I'm going to ask you to extend this leg here. Just relax. Okay. Line it up here. Okay. Looks like we're at 20 degrees. I'm going to add just a little pressure. Okay. Try to do this fast. And we get down to about 16. That's good. Okay, just relax. That's good. Now we know where we need to get to. We'd like that to get down to around 0.
Okay.
But we've got a few weeks to get that done. Okay, so now I'm going to put this gait belt on you because I'm going to get ready to transfer you to the wheelchair.
Okay.
And it's nice and bright. Got some pink and blue on there.
Just my style.
You like that pink, don't you?
Yeah.
Make sure we get this nice and tight so I've got something to just grab onto when we stand. Now, do you remember what the doctor said about that right knee, the right leg?
No weight on the right leg.
Okay. Now, do you think you can do that by yourself or are you going to need some help?
Probably need a little help.
A little help? Okay. I'll be sure to help you there. Now, let me get this wheelchair over here. Okay, I'm going to make sure the brakes are on. There we go. Okay, now what we're going to do is I'm going to have you push up against the table.
Okay.
And I'm going to say 1, 2, 3, stand. We'll stand. We'll take a couple steps this way. I'll say 1, 2, 3, sit, and we'll sit down, okay?
Okay.
When we sit, you can reach back for those armrests. Make sure you never grab a hold of my neck. You can grab my shoulders if you need some support.
Okay.
I'll try to help this knee along.
Okay.
Remember, no weight on this leg.
Okay.
Okay. So 1, 2, 3, stand. Okay. Now, can we scoot over here? Okay. Now, reach back for those handles. 1, 2, 3, sit. Good job. Okay. Now, can you pull that leg up there while I get you this foot elevated here? Okay. I'm going to have to get you out here so I can get this leg up. Now, I'm going to put this elevated leg rest for your leg to give you some support, okay?
Okay.
And then, because it gets a little chilly out in the hallway, we're going to put this sheet on you, okay?
Okay.
Now, normally I would take that gait belt off, but since we're going to be going down to therapy, and we might be using it down there, I'll just leave it on, okay?
Okay.
Are you comfortable?
Good to go.
Okay, we're good to go.